Hello Internet, it's Danielle Conway, DPT, back here for part 2 of how to help your low back pain. If you missed part 1, go ahead and click in the description box above. But today we're going to go through some exercises on how to get things stronger that you may have had troubles with part 1. The first test that we did was getting your whole body up against the wall with your heels, your sacrum, the middle of your back, your shoulders, and the back of your head. If you weren't able to get everything on the back where that whole hand can kind of slip through, then you probably have a bunch of different things that might be going wrong with you, so you might want to call up your PT to start with. The second test that we did was in standing of getting your pelvis to tilt anteriorly and posteriorly. Ways that you can do it at home, there's one where you're lying on the floor, that you can use that floor to kind of be a tactile to you to feel which way you're moving your pelvis. To start with, you can go into an anterior pelvic tilt where you're bringing your whole back up and away. You'll be able to have like a gap in between. And then you're bringing into posterior pelvic tilt where that low back gets a little bit flatter on the floor. You can rock back and forth between this because you can use that floor to feel in which direction. The second way that you can perform the posterior and anterior pelvic tilt is with the Swiss ball. You sit on a ball, make sure your weight is kind of evenly distributed between both feet. You're going to switch back and forth again between anterior pelvic tilt and posterior pelvic tilt. And you can use the ball movement underneath your pelvis, and if you have a mirror in front of you, to watch that ball moving back and forth. The third one we did was a hip hinge. This is when you had the stick up against your back and you tried to make sure the stick touched all points of your back. To work on that, you're going to take your feet and make them about 1 foot length away from the wall. Keep your knees straight and your whole back straight, and perform a hip hinge until your sacrum touches the wall, trying to maintain that flat back. When you come up, use your glutes and bring those hips forward and don't use that low back. The fourth one you're going to be doing is a hamstring stretch. This is the one where you kind of come up against the wall and making sure your leg is staying straight. So to do a stretch, find something with a little bit of a raise, a step or a stool or something like that. Put 1 foot up, make sure that knee stays straight, not bending. You're going to want to hopefully hinge from the hips so you maintain a flat back coming down until you start to feel a pull in the back of the hamstring. Stop right there. That's where you know where your end range of motion is. Any other movement has to come from the low back. So you don't want to over pull and have to reach for your hand to give you too much of an arch, because that's just pulling straight on that low back and not on that hamstring. So make sure everything's staying straight and just hinging right from those hips. The fifth one we did was looking at hip control with coming down off a step. If you weren't able to do this and your hip was coming in and your knee was bowing in, then this is a complicated one that you probably had either glute weakness or IT band tightness or possibly a weak ankle. So this is another one that's a little complicated and you might want to call your PT as well. The last one we did was looking at shoulder mobility and scapular control. This is the one where you tried to bring your arm back and forward without overcompensating and going in any other direction. So one that you can do at home is up against a wall, putting both your hands at about shoulder height, and you're going to basically just bring your chest towards the wall and then away from the wall, trying to maintain that proper alignment, coming back and forth, and nothing coming up too much towards your ears. Since we talked about that a tight quadratus lumborum can come into the play of having low back pain, I'm going to show you one that you can do at home. You're going to take a tennis ball, place it in your QL, which is basically that lowest part of your rib cage and between the top part of your pelvis, and stick that tennis ball right in that triangle area. You're going to come and lean up against a wall and basically smash up into it, either rolling up and down, side to side, or if you find that sweet spot that hurts so good, just lean into there until it starts to loosen up. If you had any pain with any of those tests that we went over, you should definitely call your physical therapist and they can find out all those underlying causes that might be causing you pain. Most of the time people come into physical therapists or chiropractors or anybody else looking to treat those painful spots, but those can really just be the symptoms and not really that underlying cause. Using those checkpoints that we kind of went over, you can really look and see what you're having issues with, and then come into a physical therapy place and we can help you look through and reevaluate each of those different things, that we can help learn new movement patterns that can make those pain-free motions a lot better, either if it's from the hips of having trouble leaning over to pick up that dirty laundry, or if it's from the shoulders, that tightness reaching overhead that you're overcompensating with the low back. If you have any questions or if you like the video, please feel free to share or like and call up Breakthrough and we can help you out.